Rob is one of the physios and directors here at Southern Suburbs. He was the 1990 and 1995 National Cross Country Champion, represented Australia 5 times, physio for Athletics Australia since 2000, and he's been away with the World Cross Country team every year for about the last 10 years. And Rob and I went through uni together, and we've been working alongside each other for about 15 years. And it's still interesting where we work here down in the back section and you can hear other people talk, is that I still find every time I listen to Rob talk, particularly with the runners, that you learn something new, because things just progress all the time in health and medicine and running and technology. And again, Rick's talk about shoes just blow your mind with the technology with shoes. But Rob's knowledge of not only general physio but runners and running injuries is astounding, and he's here tonight to talk to you about hopefully how to avoid running injuries. So across to Rob.
Thank you. It's good there's not as many. Last week I felt like I was talking to half my patient list, so they already knew most of what I was going to say. There's some familiar faces here, but not as many. What do I do? They're already in my pockets, all right?
Yeah.
Forgive me. My car. So yeah, you've clearly had the spiel. In my skinnier days, I'm probably the person in the room that has put on the most body weight going around, so none of you should be, maybe John, who, as I said, he's done a lot more marathons than me as well. But yeah, once upon a time I could run a bit. These days I take more pleasure in trying to keep people on the track. But from my running days, that probably spurned my interest in treating runners and in running injuries, running mechanics. So hopefully tonight, sorry I've gone the wrong way. Hopefully tonight I can teach you a bit about running injuries, how to prevent them. It's not the role of the talk to go into too many specifics about individual running injuries, because I could do 2 full talks just on that. But needless to say, some running injuries are easy to avoid, and they're the ones where all you have to do is keep your eyes open, stay close to the front of the pack and not too close to the people in front of you. Others, like this poor fella, especially in marathoning and ultra stuff that you'll hear a bit about later, many of us have needed to pull over to the side of the course to get rid of some excrement, and sometimes it's not so easy, as this fella found out. But gastrointestinal problems can be an issue. Needless to say, the majority of running, or distance running, which is what I'm largely talking about and what we're largely talking about tonight, distance running injuries are overuse in nature. The main 4 things that I tend to look at and discuss with people when they present to me with running injuries is their training program. Dave and Nikki will go into it in much more detail later, but the location where they train, the surfaces they train on, all impact whether you're at risk of an injury. Variation being the key, that's the number 1 thing I'd say to you. Footwear, again, Rick will go into in much more detail, but it's clearly a factor that I consider a lot. Biomechanics is a big thing. That's something I'll talk about in more detail as we go, but biomechanics and getting your biomechanics to fit footwear that you use and that sort of thing is very important. And finally, listening to your body. I could finish my talk now and just say the best way to avoid injuries is listen to your body. The main thing that I say to everyone is, if you get a niggle, don't just try and push on through it. Usually I use a thing called a 2-day rule, and that is, if you've got a little niggle, take 2 days off, rest, anti-inflams, ice, have massage, physio, that sort of thing. Then start with an easy run, depending on what you're doing, 20-30 minute jog. And if your pain's still there, seek advice. If it's not, build back into your training. And the 2-day rule can help avoid many injuries. So put that into your repertoire. Just quickly from my point of view, before the specialists talk about it in a bit more detail later on, footwear, certainly important in trying to avoid injuries. The main things I'd say, change your shoes regularly, use a great variety of shoes. So the one thing we know about your body is it doesn't like repetition. Running is a very repetitious thing anyway. If you are running 10k 4 times a week, you're probably taking 40,000 odd steps. Each time 3 to 4 times your body weight in forces going up through your body. So it is a very stressful thing. So variation in shoes, in training surfaces, that sort of thing. Get expert advice. Active Feet certainly one of them, but there's some good shoe shops around where you can get good advice. Usually to an extent, if you find a shoe that suits you, stick to it. But as I said, I wouldn't just run in one type of shoe, and Rick will certainly expand on that later. Training programs, much the same. Keep a diary is something that's really easy these days with Strava and your Garmin's and that sort of thing that people use. A lot of it downloads straight onto a PC rather than the old manual diary that we kept. But certainly keeping a diary, it allows you to look back and see what you were doing when you were going well, and versus when you're injured, if you're doing something different, that sort of thing. So it's certainly a good reference point. Vary the terrain, a bit like the shoes, vary the terrain you run on, you train on, largely to try and minimise that repetitious nature. Under-train is a big thing. Steve Monaghetti, who I did a lot of running with, I reckon was the best under-trainer going around. It's consistency of training that will improve your performance, no matter what level you're running at, more than anything. And listening to your body pops up again. That kind of leads into this. Beware of super sessions, as I used to call it. The main thing a training program should be based around is aerobic running, okay? So slower running. As soon as you get too focused on doing sessions, and a lot of people do it, especially if they're running in groups where they'll run once or twice a week other than going to a group, and that group session tends to be interval stuff because it's more interesting and that sort of thing. And as soon as you become a bit too focused on that, you are really putting yourself at risk of injury. So focus on sessions equals sacrificing continuous running, and that is putting you at risk of injury. Be fit enough through your long runs to absorb sessions is the best way to stay injury free. As I say, especially more at the elite level, it's important, but it's not life or death stuff. Be willing to have rest days and jog if you're sore. The worst thing you can do is do a hard run if you're a bit sore. You're just going to be speeding yourself up to in this clinic. Not that that's a bad thing. Anthony's emails told us that a lot of people are interested in calf Achilles problems, so I've put it in there. I'm going to just go over a few basic running or common running injuries and some brief detail about them. The main thing we know about calf Achilles problem, it's all about load. You need to be the load master. If you can modify your load to a level that your Achilles, your calf can cope with, then you'll do pretty well. Frequency, intensity, duration, which is that FID, basically going out or increasing too quickly. How often you run, how hard you run, how long you run is what leads to calf Achilles problems more than anything. From a physio point of view, as far as trying to prevent and treat these sort of things, joint range, ankle joint is what I'm talking about. So your ability to get your knee over your foot is one of the most important things. And especially from a prevention point of view, if we are lacking what we call dorsiflexion, so your ability to get that knee over your foot, then the vertical forces up through your calf and shin are going to be higher. You don't get as much elastic recoil when you run. Your body is a lot like a lacquer band with running in several joints, and the muscles, tendons around them will wind up. You'll put them in a stretch position and they'll spring back, and that is certainly the case with the calf and influenced by your joint range. So getting that ankle range is really important. So it's something, it's as simple as literally doing a knee to wall sort of thing. You should, as a general guide, if you can get your big toe about 10 centimetres out from the wall and be able to get your knee to the wall without your heel lifting, then you've got reasonable ankle range. Poor calf endurance, it's certainly what all our studies tell us is a big factor in preventing calf Achilles problems, treating calf Achilles problems. So improving your ability to just do simple calf raises. I'll often tell people, just in the shower is a good time to do it. Build up. You can do, 100, 200 calf raises. That's not too many. So just build up your ability to do calf raises. Plantar fasciitis, heel pain, heel spurs, a lot of people talk about, which are really just a side effect of plantar fascia. It's the plantar fascia that's a problem, not your heel spur. It's a difficult running problem, and this is where listening to your body comes into play a lot. The sooner you can get onto this, it's all about taking load off that plantar fascia. So basically a big fibrous band that goes from the inside aspect of your heel bone right down to your toes and your big toe in particular down here. It takes a lot of load, can be influenced by poor running mechanics, footwear, surfaces we run on, that sort of thing. Once it becomes chronic, we use doctors a lot more, injections, a topic at the moment with the Essendon stuff, but certainly injections play a role in treating some running injuries, cortisone injections, blood injections, that sort of thing that you may have heard about. Certainly footwear, which Rick will talk about later, has a big role in helping us control or get rid of plantar fascia problems. ITB friction syndrome, which is lateral knee pain. It's basically a problem from up here. You've got little sacs of fluid down here that can get inflamed and irritated when your ITB gets tight. It introduces an area that we'll go into a bit more detail around your pelvis, your glutes, being strong up around there. So biomechanical issues, weak, tight areas around your hip and buttock are the answer to ITB problems. Back pain, everyone's general problem that you get, and runners certainly do. The main advice I tend to tell runners is when your back is sore, running's not a great thing, mainly because of the shearing forces, the stress forces that go through our spine just from pounding away all the time. When your back is good, running doesn't cause bad backs. Most distance runners end up with a very stiff back, not necessarily a sore back. So it's not a cause of back pain. Atypical sciatica is a common running injury. It's largely related to the deeper muscles in your backside where your sciatic nerve can get irritated. I call it, as I said to the group last week, atypical because it's not true sciatica. It's not coming from your back, a nerve compression in your back. It's usually just compression irritation of your sciatic nerve through your backside. So a lot of you may have experienced buttock pain referring into your hamstring, that sort of thing. And as a general rule, if we release you through there, and again, as we'll get into it now, strengthen through there so you've got a good stable pelvis, can certainly help. With that in mind, to make running mechanics really simple for you, then not that simple, but running is all about being strong on one leg. Okay, we are never ever on two legs when we run, and single leg balance is a really important thing, both in the stance phase where it's all about controlling our pelvis, but in the float phase when we're going through the air to counterbalance between our arm and our leg to keep us in a straight line and running efficiently. So balance full stop, but single leg balance in particular is really important. And if nothing else, if you can just practice, I tell people, if you're waiting in a queue at Safeway or in a bank or that sort of thing, just stand on one leg. Spend as much time getting comfortable on one leg as you can. The more control you can have of your pelvis on one leg, the less likely you are to get injured. So yeah, it's the foundation principle of running and therefore injury prevention. So one of the things people wanted from last week, that we're just putting in there a few exercises that allows you to do that. Single leg squat, which is basically that fella standing on one leg and practicing getting his knee going down over his foot. The thing a lot of you will find when you do that, largely because of poor stability and weak muscles up here, is your leg will want to fall in. Your foot has a role in that as well. So the idea is being stable through here, you've got two bumps of bone on the top of your pelvis here, keeping them level as you do stuff, and then being able to bend your knee, keeping them level and your knee over your foot. So you don't want to be dropping in or falling out, losing your pelvis. It's all about keeping this still as you run from foot to foot. Okay, so single leg squat, certainly a good one. This is just making it harder. She's doing an exercise to really use her glutes more, so she's coming here and then rotating. So that's using her upper hamstring and her glutes a bit more, but it's just progressing the same exercise, trying to keep or get stronger through her pelvis and the muscles around it. Progression again, I won't demonstrate that because I'll fall over. Hamstring tightness, bend your knee if you're doing that and your focus is on keeping your pelvis square and things. Just let your knee bend, because like me, a lot of you might be really tight in your hamstrings, and if you do that, as I said, you'll fall over. But if you can do that and just focus on your pelvis and get your hands down, and you can rotate and things like that, it's all about just trying to make it harder. We add weights to that sort of thing, rubber. You can make it harder, as hard as you like, and as one gets easy, then you just move on to the next. So that will certainly help control one aspect of the running cycle, and that is a good stable pelvis, and it's a good platform to start from. It's the keystone to stability. So if we combine that with good ankle range that we were talking about before, so you're controlling two key points of running, and that is the first point of contact being your feet, and controlling your shock absorption and how much vertical forces are going up through your body, and then good pelvic control, you'll go a long way to staying injury free. Stretching, a controversial topic, and anyone can get in this position at the end of the night. I reckon Rick will have a free pair of shoes for you. Put the pressure on. Stretching, very controversial, especially in the role of injury prevention. Okay, when we talk about running and running mechanics in particular, a lot of the range that we need when we run comes passively. So doing a static stretch, so we've got two types of stretches, static and dynamic, and doing a static stretch is not necessarily, if I'm really tight in my quad, it doesn't necessarily mean I won't have good hip extension when I run. And hip extension when we run is important. So it's as I said before, about the elastic recoil that we get in running, and just a pendulum. You know, if you get a hinge and swing it, as you swing the top part of the hinge, so my thigh forward, that's going to make the bottom part swing up. Okay, so you see runners being able to kick their butt when they run, have a high back lift. It's not necessarily because they've got great range through their quads. It's more about the mechanics of their running. So static stretching doesn't necessarily make you run better, and you'll hear a bit more about that in a minute. And stretching per se doesn't necessarily make you more likely to avoid injury. So there's little evidence to say that stretching prevents injury, or that it should be a major component of warm-up, or that it prevents post-exercise soreness. So out of that, you're probably going to think that I don't think a lot of stretching. Stretching does have a role. Carl Lewis here, the reports I've heard is that he couldn't reach past his knees, but clearly when he long jumps, he could go a fair way. So again, it's the dynamic component of the activity more than his hamstring flexibility. So yep, does not mean that stretching has no role. There's many things that we want to stretch for. Kids going through growth spurts often get very tight, and we want to stretch. Some people have true muscle tightness that we want to free up. Post-injury, like Dave at the moment over here. Forgive Dave tonight if he hobbles a bit. No, he's not injured, but he is injured, and he might be hobbling a bit tonight, but he's going to potentially stretch and get that free. Postural conditions, not so much running stuff, that's more your upper back and neck and things. Hypo versus hypomobility, in other words, too little or too much mobility. Some people are very mobile through their joints and things, and we don't necessarily want to be stretching them to make them more mobile. So does stretching actually increase injury risk? And there's some evidence to say that it does. So stretching may reduce strength for a period of time after you've done it. And warm-ups with no stretching may improve performance. So as a general rule, I'd say to warm up for running, you don't necessarily need to stretch, but what you do need to do is run or walk for that matter. So low-grade aerobic exercise is your best injury prevention tool and performance improver tool when it comes to running or exercise, full stop. General suggestions with stretching then, just to summarise it: limit the amount of stretching you do before you run. Dynamic warming up is better. By dynamic I just mean run, okay? Start running slowly and get quicker. Say our running, when I was running seriously, we'd go 4 or 5k just really at a pace until you start sweating sort of thing, and that was our guide to whether we were warm enough to start doing something more intense, okay? Very basic but low level, 15-20 minutes of low level exercise, and then do more specific stuff, be it strides and that sort of thing. So it does play a role with certain things, so I'm not saying don't stretch at all. Best performed after muscles are warm, so certainly after you've done some exercise, and as a general rule 30 seconds is thereabouts. Injury prevention. The problem we've got with running per se is it's stressful. Okay, it really does. No matter what there'll be people in this room that are training for, say, Melbourne Marathon, and you might be building up to anywhere from 40 to 150k a week to train for your marathon. And in doing that, you're going to risk injury just from the pure nature of running. So the most important thing is do recovery stuff, do the things that we've talked about already as far as improving your stability and things like that. All you can really do is minimise the risk of injury. The fact is, if you run enough, we're going to see you at some stage. And all you can do is minimise it as best you can, and even minimise the severity of it by getting onto it quickly. Recovery, as that leads into, is really important. Adequate recovery is as important as any other part. Dave's going to talk, or Dave and Nikki are going to talk a lot about training and training programs, and the main thing I would say is what you do after you train is nearly as important as any session that you ever do. And when I talk about recovery, talking about all of those sort of things: rest, sleep, spend plenty of time on the couch watching TV. Hydration, nutrition are important. I think Dave's going to go a bit more into nutrition stuff tonight. It may be, we've got a lot of feedback that people want to hear about nutrition. We haven't covered it in detail in tonight's talks, but it might be something that we do future talks, so stay tuned for that. Warm downs are just as effective as warm up, and warm downs may have a greater role for stretching. 2-day rule that I mentioned earlier, so if you've got a niggle, try and get off your legs as quick as possible and do all the little things as far as icing and stuff. This fella in an ice bath works really well. You'll see the footballers down the bay in the freezing cold water. It really does help with your recovery. Psychological factors, again, Dave will go into a bit more of that. Compression garments, they all play a role in what I call the 1%ers, the little things that can help make you recover better and avoid injuries. Gait analysis we've thrown in there largely because we're amazed to hear, and we'll pose the question again tonight, given running is a stressful event that is influenced strongly by your mechanics, what number of people in the room have ever had their gait assessed by anyone, videoed or anything like that? Who's had it done? One? Couple? Yeah, and that's the same sort of response we got last week, and it's probably something that a lot of you want to consider doing. You know, if you can get a good video analysis where people will look at you from front and back and be able to give you advice and some exercises on what is tight, what might be weak. It's very easy to look at someone from behind, put some marks on the back of their back and see whether their pelvis is dropping on one side each time I land on my right leg if my left side's falling. And as I said last week, if you do a 10k run and 10,000 steps and your pelvis is dropping every single one of them, no doubt you're going to get problems sooner or later. V-Move, which this has got in there, V-Move is these electrodes. It's not available. We do it with our gait analysis stuff. It's a high-tech piece of equipment that allows us to see whether people are running symmetrically. In other words, whether you're putting more weight on one side than the other, be it from an injury that you're recovering from or just a biomechanical deficit. So the more information you can get about your running style and running mechanics, the better, I would say, and the more likely you are to avoid injury. So my summary to that, I think I'm going all right time-wise. Yep. Train smart. Under-train is the big thing. Train on variable surfaces, in variable shoes, get plenty of sleep and get your niggles attended to as quickly as possible. And 2-day rule falls into that. Always seek advice from be a doctor, physio, podiatrist, massage therapist, whoever. Make sure they are, if they don't run themselves, they certainly treat runners and they know about runners. I think we've all been to people, there were several times I went to doctors and they said, you're not supposed to run 170k a week, just stop and you'll be right, and that's not the answer. I just say see people who know about running. Certainly I'm not the only one of them in here. There's plenty of physios here that know about running, and there's other clinics around. Anyone, I imagine people have travelled from all over the place. If you want to know a physio, and Rick could probably say the same for podiatrists, if you want to know a physio or a podiatrist around wherever you live, just let us know and we should be able to tell you. But see people, and doctor, same factor there, see people who know about running.